Hello everyone, today we are going to see acute inflammation. First of all, what is acute inflammation? So it is a host response and it's a very rapid response. So it's a rapid host response and the aim is to deliver leukocytes and the plasma proteins, that is antibodies, to the site of tissue injury. Okay, so this is the basic definition. Now, there are three major components in a acute inflammation. The first is alteration in the vascular caliber leading to increased blood flow. Next, there are some structural changes in the microvasculature which increases the vascular permeability so that plasma proteins and leukocyte can leave the circulation. And the third event is the emigration of leukocyte from the circulation and their accumulation at the site of the injury and then their activation to eliminate the offending agent. Okay, so these are the three major events. First is increased blood flow. Third is increased, first is increased, we can say alteration in the caliber of the blood vessel, vascular permeability, and then emigration of leukocyte from circulation. So these are the three major components of acute inflammation. Now we can see this in this diagram. First thing we can see over here is the arteriolar dilation. Okay, and venular dilation. So leading to the expansion of the capillary bed and it increases the blood flow. The first event is this. Then we can see the neutrophil emigration outside the vascular space. And third is the leakage of the plasma protein and edema. Okay. So these are the three major things which happens in a acute inflammation. Now Celsus has given four cardinal signs of inflammation. One is rubor, tumor, color, dolor. Rubor means redness. Tumor means swelling. Color means heat. Dolor means pain. And the fifth sign is added by virtue, that is function lesa, that means the loss of function. So these are the cardinal signs of inflammation. Okay, now let us see the stimuli for acute inflammation. These could be some infection or a microbial toxin, or could be tissue necrosis, that could be because of ischemia, trauma, or some physical chemical injury, or maybe a foreign body, or maybe an immune reaction. So anything from infection to immune reaction, foreign body, or any toxin, any tissue necrosis can lead to acute inflammation. Now, what are the events we have already seen? One is the alteration in the vascular caliber, then increased vascular permeability, and third is the cellular event, that is emigration of the leukocyte from the microcirculation and their accumulation at the foci of the injury. So we have vascular event and we have cellular event. Coming to the vascular event, the first change is the change in the vascular flow and the caliber of the blood vessel. So it leads to vasodilation, which is the earliest manifestation of acute inflammation. Sometime preceding vasodilation, we have a transient vasoconstriction of the arteriole which lasts for only few seconds, and then it followed by vasodilation. Now vasodilation first occurs in the arterioles and this leads to opening of new capillary bed in the circulation. Vasodilation is induced by several mediators like histamine and nitric oxide. Then following the vasodilation, there is increased permeability of the microvasculature which leads to outpouring of the protein-rich fluid into the extravascular compartment. Now we have loss of fluid and also there is an increased vessel diameter. So what will happen? There will be a slow blood flow and also because of less content inside, now there will be increased viscosity. Because fluid kam hoga, cellular content will be more, so there will be increased viscosity. And all this will lead to the stasis. Okay. Now as the stasis develops, the blood leukocyte will accumulate along the borders of the vascular endothelium. They will accumulate along the borders. Okay. Now the second event in the vascular phenomena we have seen is the increased vascular permeability. Now what are the mechanisms for increased vascular permeability? First, it could be retraction of the endothelial cells. Here we can see the diagram. The endothelial cells are retracted and therefore there is emigration of leukocyte and other content outside. This can happen in venules and this is induced by histamines and nitric oxide, and this is a rapid and a short-lived response. So one thing could be retraction of endothelial cells. The other mechanism could be endothelial injury. Now endothelial injury, here we can say the endothelium is injured. It can happen anywhere, arteriole, capillary, or venules, and these are caused by some injury like burns or microbial toxin, and this stays for long. So this is long-lived. Now the third mechanism could be leukocyte-mediated vascular injury. So leukocyte itself is causing vascular injury which will happen at the later stages of inflammation. This is seen in venules and this will be long-lived again. And then another mechanism could be increased transcytosis, that is through the cells. This happens in venules and it is induced by vascular endothelial growth factor. So these are the vascular phenomena. So what did we see? We see first of all there is vasodilation, then there is increased vascular permeability, and then there is stasis. And because of stasis, the leukocyte, they migrate to the border along the endothelium. Now we'll go to the cellular event in the next class.